COVID pandemic has very clearly shown the effect of healthcare directly and indirectly on the economy. In the last 2 years, economies and every sector of the country has suffered a huge loss, loss of jobs, money, and the inconveniences. So we thought that this time the budget will be health centered, and unfortunately, it wasn't so. Though it looks good on economic front, the Gati Shakti and all that will revive the economy. But we have seen that unless there is a sufficient resilience in healthcare, in health, people cannot even become educated. Health is prime requisite for education, for economy, for everything. This was a missed opportunity. Unless we develop a robust healthcare delivery, public health, the controls, and various other parameters, which is desperately required for a country of this size. If you see the amount of GDP which is being spent on healthcare is abysmally low, much less than many developed countries. And this country, of course, needs far more. So this is something which we missed big time. Though there has been increase in healthcare outlay, they have gone up from 71,000 crore to 83,000 crore, which is approximately 16% increase expenditure. There is 7.4% increase in NHM, National Health Mission, which is important for the controls of disease, especially in childhood, pediatrics, and various age mothers, infant mortality rate, and all those, which is very important and which is a low cost, low hanging fruits. That's a good thing to have happened, but not spending significant part of GDP into creating a robust healthcare delivery system, the inequalities will increase. If you see that in last year in pandemic, people have become poorer because they have invested close to 50 to 70,000 crore seeking healthcare in COVID alone. The number of people who have died is probably far more than the number one killer, equal to cardiovascular disease and more than the stroke and other diseases put together. That shows that are we getting prepared ourselves for the similar pandemic in future? Unfortunately, no. Though I agree that economics takes priority, but we shouldn't have shunned healthcare to that level. We have not really made any significant impact, which is very sad, which is a really sorry state of affair for the country of this size. They should have really thought about giving a little more proportion into public health. They would have invested into giving swaps, in getting people health checkup done. They should have invested into various GST support to the healthcare delivery people. Lot could have been done, but it was missed big time. See, the inequalities can only be addressed by controlling the disease pattern, ignorance, and by nutrition. So the providing the jobs. What leads to insecurities, inequalities? Disease. Disease could have been addressed by healthcare investment. We need to have a universal healthcare. Instead of that, we got Ayushman Bharat, PMJ scheme, Pradhan Mantri Jan Arogya Yojana, and they have not increased the allocation to that, which could have got lot more people treated. Rather, what they had allotted last year, only half has been spent. That means there is some serious problem why people are not able to make use of it. If someone tells me that there are not enough people who are sick in this country, that's something which you and me will not accept it. Obviously, people are falling sick. So when you have a Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, and you are not being able to implement. The big hospitals have not accepted that. It's still, most of it goes to the government hospitals, and the tertiary care and high secondary care are being missed. There's a lot to really find out. And the very fact that government did not pay attention to that in this budget is really very shocking. All over the country, those who are in healthcare, we feel that we should have been a little more responsible towards our citizens of this country. Thank you very much for having my views.
For more updates from CXO TV, please like and subscribe to our channel.